Hey guys, Stuart Hinds, stuarthinds.com. We've got Tom. We're now going to be looking at the hip again, but we're going to look at the gluteus minimus muscle. So a really important muscle, loves to refer down the legs. Let's have a look at it. Go for it. This video is brought to you by Premax Essential. So it's a medium glide massage cream. It has an awesome, wonderful balance between the glide and the grip, which just makes for an all-round massage cream. All the Premax massages are non-greasy, which is awesome because I hate too greasy massage creams. They're also long-lasting and they wipe off really, really easily, so which is great for when you're taping your clients as well. It obviously leaves the athletes feeling really clean, fresh, and believe it or not, moisturised after their treatment, so that's a bonus. I have my own special offer on these really awesome creams, obviously in the link below. So please watch the video, like and subscribe, and just check out the link at the end. So the last piece in the jigsaw is going to be the wonderful gluteus minimus muscle. So we've got medius around here. I know that's really important. I know everyone loves that muscle, and I know it refers into lower back, has a great relationship with QL, but what's often missed, especially with cyclists, and as far as I'm concerned, is this glute minimus muscle. So obviously find the greater trochanter, you come above that and you're all into that little tissue there. So it sort of runs anteriorly and then posteriorly. So it's a really important muscle, as I mentioned, because it is our pseudo sciatic pain muscle, okay? So in all of these videos that we're doing in terms of this hip release sort of stuff, we're going to be using the forearm again. So we're going to find the greater trochanter, which is not difficult to do, which is basically right there, around there. We're just going to sink on the top again, all right? Lean into it, and then we're going to work along the length. Now it's not that long, okay? So you're basically going to sink on, and then you're going to slide. You'll see your pressure's coming through. Got your body weight right over the top of it, and you're going to work right across. Oh, yep. So there's littered with lots of little trigger points through there, and they refer deep in the bum, some down the back of the leg, all the way down the back of the calf, or even down the ITB in the lateral part of the calf. Okay, so once again, in terms of treating this, we can spend a good 2-3 minutes of working really purposeful along here. I like to get a significant amount of pressure that's not too much that they're going to guard against me, and then obviously then I can just sit right onto it.
So if you even remotely enjoyed some of that content, please do me a favor and hit the like button below, just so that I know that you did enjoy it. Also, if you don't want to miss out on any of the content that we put up on a regular basis, then the best way to do that is obviously just to hit the subscribe button. So it's a bit of a no-brainer. But most importantly, if you really want to see the true show, the real show, take the opportunity, hit the link below, stuarthinds.com. That's where we have all the comprehensive assessment, treatment of a whole range of conditions. That's where we have our online courses and obviously our mentoring and so forth, the webinars and our podcasts. So if you're even remotely interested in what we do, go and check it out. Appreciate it. But also, most importantly, again, just be awesome at what you do.